PICO is a novel, canister-free, single-use system that combines a discrete and portable pump and a pioneering multifunction dressing which is designed to deliver negative pressure to the wound surface and to effectively manage low to moderate exudate without the need of canisters or frequent dressing changes, made possible by a combination of absorption and evaporation of moisture. Let's go beneath the surface on how PICO unites the benefits of a multifunction dressing to manage exudate, combining absorption with evaporation, with negative pressure wound therapy properties. PICO's multifunction dressing has been designed to allow negative pressure and to effectively manage exudate with a pioneering dressing design. 1. Effectively manages exudate. The perforated gentle silicone adhesive wound contact layer allows transmission of negative pressure, allows fluid to pass through it. It's easy to apply, reducing the time used and frequency of dressing changes versus conventional dressing. Helps to minimize trauma and pain to the peri-wound area on removal. Will not adhere to newly formed tissue. Is well tolerated when applied onto the wound. The airlock layer, which is unique and proprietary to Smith & Nephew, maintains open airflow and maintains 80 millimeters of mercury negative pressure across the entire area of the exudate management system. Holds its structure under pressure, so device remains functional as it doesn't collapse. Negative pressure is maintained throughout the dressing without disrupting wound exudate absorption. The absorbent layer not only absorbs and locks exudate, but it is also designed to move exudate away from the wound and aids evaporation, resulting in a high total fluid handling capacity by combining absorption and evaporation. No need for a bulky canister, which allows greater mobility and patient concordance. Fluid is locked away from the wound to minimize maceration. The top film layer with a high moisture vapor transmission rate contributes to the total fluid handling capacity by allowing one-way transpiration of exudate vapor, resulting in no need to evacuate exudate into canisters. Protects from infection as bacteria can't pass through. PICO manages fluid by evaporation and absorption, where 80% of fluid is evaporated whilst 20% of fluid remains in the absorbent layer of the dressing. 2. Acts as bacterial barrier. PICO protects from external contamination. Provides a closed, moist, ideal wound homeostasis, minimizing wound desiccation and minimizing heat loss. 3. Helps reduce edema. May stimulate lymphatic drainage, which clears interstitial fluid. 4. PICO helps improve perfusion, stimulating blood flow that may promote angiogenesis. 5. PICO promotes lymphatic drainage, essential for an optimal healing environment. 6. PICO helps reduce seroma. 7. PICO helps reduce hematoma. The impact of PICO in removing edematous fluid, stimulating lymphatic drainage, and restoring normal blood flow reduces hematoma and seroma in closed incisions. 8. PICO helps reduce incision lateral tension. 9. And increases incision tensile strength. Bring edges together. Can reduce lateral tension, side to side, by 69%. Can increase tensile strength. 55% more force is required to separate tissue, which is very important for T-junction sutures in breast surgery or donor sites. 10. PICO stabilizes the skin. Immobilizes skin grafts in places which facilitate successful graft take. 11. PICO promotes microdeformation. Cells are stimulated to proliferate, leading to new granulation tissue formation. This occurs with both foam and galls, both compatible to be used with PICO. 12. PICO supports macro deformation. When negative pressure is applied to a wound, an immediate reduction in wound area or wound contraction occurs. This reduction in wound area appears to be permanent. This contraction causes stretching of surrounding tissue, leading to effects in the tissue such as increased blood flow. 13. Treats the zone of injury and peri-wound area. 14. Available in a variety of shapes. PICO is a clinically proven system with 69 clinical posters, 57 published clinical papers, 11 ongoing randomized controlled trials, 5 completed randomized controlled trials. PICO multifunction dressings provide you and your patients the benefits of a gentle, absorbent and evaporative dressing that has also been engineered to ensure effective negative pressure is delivered onto the wound.